between the hospitals. When it's needed, okay. So the patients, all the medical informations. Okay. So the data security, how we are going to enable, as well as the interoperability issues and those things, how we will be overcoming that. So that's what we are going to see for today. So the when you talk about the health services, so it's we'll be involving the variety of technologies. Okay, so we'll be enabling the different services. When you want to enable the different services from the telemedicine point of view, so we need to ensure that we'll be having the EHR, electronic health records. When the patient is visiting the doctor, so we'll be having the all the health records. Okay, so when you have all the health records, so the patients can be treated in their location, so the home itself. It enables the physicians to see all the results, the records, health records about the patients. Okay, so through the telemedical process, so the physician can discuss, they can consult with the patients can consult with the doctors from their home. So that's a kind of services, PL services will be providing. So when you are providing this kind of services, definitely the health records are very very important. So when you're having electronic health records, it's most recommended one to enable the physician to discuss with the patients. So whenever the patients require the consultations, they will be communicating with the doctors. So when you talk about the health services, through the telemedical applications, so we'll be involving the electronic health records. So the patient medical history, we can say. So how we are going to safeguard the medical history. So we can say, we need to ensure that the safeguarding all the medical informations. Okay, so because the patient will be visiting the doctor, so they will be showing the reports and all those things through the communication medium. So when they have through the communication medium, so how we are going to safeguard the medical histories, that is very very important. So when you are ensuring that safeguarding the medical histories and all those things, then um, both the parties, the patients as well as the practitioners, will be having the confident that, so they will be working with them and the treatment purpose and all those things. So when you are looking for the electronic health records or the patient records, so that will give you kind of improving clinical communication efficiency. So the error might be reduced. Then we will be the practitioner will be, or physician will be taking all the results for the diagnosis purpose as well. So once the diagnosis is done, then they will be starting the treatment. So this will give you all the information, so that can give you kind of access to the physicians to take the decision for the diagnosis as well as for the treatment planning. So this information, whatever the patient records, we need to ensure, we need to safeguard the patient records. So when you are talking about the safeguarding the patient records, so how the security management, so how we are going to secure the information. So when you're talking about the security management, so we have like a, so how the integrity, so whatever the data we collected, so in the form it should be available. So all the data whatever we have collected, so that should not be tampered with anywhere. So the misuse of altering the data and other things, so it should not happen. Okay. So similarly, they need to talk about the privacy. So all the patient informations whatever collected, so it's not at all shared with the unauthorized entities. Okay, so that is also very very important. Then confidentiality. So when you want to have all the information, so you need to safeguard the personal and the corporate informations. Okay, so whatever the patient records we are collecting, so from the patient, so that should be safeguarded, as well as the development plans and the work schedules of all the departments. So this all has to be kept with a strict confidence and all this. So again, when you're looking for the security management, so the availability of the information, so we need to have the system, so the whatever the system we are working, so that should be available all the times, so without any breakage and all this. So this when you look this security management is very very important, that confidentiality, privacy, integrity, as well as the availability of the systems. So if any breakdowns, then um, it will be any issues, malfunctions and all those things, then it leads to the some kind of questions to the data security. We need to ensure the computer system security. So whatever the hardware and software, so whatever we are using, how we are storing the data into the computer, so that should be available all the time. So availability should be there. Similarly, we need to ensure that all are accessible. So we need to ensure that ensuring the against to the virus infections and all those things. So this has to be taken. So proper antivirus installations and all those things has to be taken, so that the computer system security level is increased, so nobody can access that. So that is very very important. Similarly, we need to have the physical security. So where you are involving this the system as well as the equipments. So the location of the installations area should be monitored. So that should have the kind of restricted access. So when you are looking for the restricted access, only authorized people will be entering to the region and all those things. So similarly, we need to look for the some kind of uh, the password and all those things, so that it will be so. Sometimes some regions will have the open access areas also, so we need to monitor the open access as well as the restricted access areas. So the monitoring should be there, the physical security. Similarly, we need to have the operational security. So when you are looking for the operation security, so what are the systems, so the equipments we are using, so we need to get the condition of the equipments, so how the usage and locking, how those who are involved in the locking into the equipments and other systems, so how that ensuring that a clean power supply. So because the power supply should be the continuous power supply should be there. So we need to ensure that uninterruptible power supply. So through the UPS and other things, so that can be there. So similarly, we have like a communication security. So this is another important area. So when you talk about the communication security, so we'll be having the network connectivity. So all the equipments, whatever we are using, as well as the computers, so that will be connected with the network. So when you are connecting with the network, so through the routers and all those things, you will be connecting. So when you are accessing the network, so we need to ensure that the possible attacks and all those things. So we need to ensure that the attacks are avoided. So the firewall, you need to ensure that the firewall, so nobody is accessing into the uh, the network and all those things. So that's you need to ensure that. So that's a computer communication security. Similarly, when you are using all the preventive measures and all those things, So we'll be able to reduce the risk of security attacks and all those things. So all the informations whatever we are dealing with for the telemedical applications, so we need to involve the secure we need to involve the security management, so to secure the informations. Okay, so when you're dealing with the security management, so that security management is will be having the combination of process. So starting with the preventions, detection, as well as the reactions process and everything. So because once ensuring that any attacks are happening, so we need to get the reaction process also. So the detection, once the detection is happened, so some kind of malfunctions, some hacking is happening with them, the data with that, so we need to have the reaction process also. So that is very, very important when you talk about the entire system. So when you're looking for uh, the electronic documentation and the healthcare, so we'll be having the all, several times I repeated. So we'll be having the all the medical records of the patients. So when you are looking for the medical records of the patients, so we need to ensure that once it's converted with the electronic documentation. So when you're looking for the electronic documentation, so we need to have the electronic data entry as well as the data extractions for the preparing the plans. Okay, so how the treatment plan, so how the patients will be taken care, so the patient plan care plan can be taken, how the patient will be given the education point of view, so educating creating the awareness, so discharge plan, so when the patient is discharged from the hospitals, how that can be taken, so all the things to be done, so everything can be taken here. Okay, so for this entire things we need to plan for the electronic documentation, so that is very, very important. So when you talk about the electronic medical records again, so we have like digital versions of paper charts in the clinician office, clinics, hospitals, so everywhere we will be getting as some kind of the information, so that all information has to be recorded here. Okay, so when you talk about the EMR, so that has several informations. So all the informations collected from the different sources. Okay, so from the labs as well as clinics as well as hospitals. So they will be collecting all the information. So that all informations uh, it will be useful for the treating the patients. So they need to diagnose and they need to plan for the treatment. So that's very, very important. So the medical records is going to give you a major role here. So if the medical information is some kind of tampered and altered, so it's going to cause the very high risk to the patient. So that is very, very important. So um, uh, you need to ensure that all the medical records are in the safer hand. So similarly, when you look for the EMR, so that's going to give the planning care for the patients. So when you are looking for the planning of the patient care and all those things, we can ensure that it's going to provide the better health care. So uh, by providing the very accurate data up to date, that is also it's very, very important. So all the data has to be updated up to date, it should be there. So we should have the complete information about the patients. So whenever we are enabling the point of care to the patients and all this. So the another important area of the advantage of EMR is enabling the quick access. So when you are enabling the quick access to the patient's records, so uh, from the physician end as well as the patient end, so they'll be having all the information, so that it is very easy to coordinate as well as to provide the efficient care. So similarly, we need to ensure that enhancing the privacy as well as the security of the patient's data. So several times I repeated here. So the patient data is one of the important informations that should be ensured about the privacy as well as the security level. So when you talk about the characteristics of the electronic records, so we need to have the authenticity. Uh, so what purpose we are collecting, so the record must have all those things. Then the reliability of the information, so we should have all the informations. So the particular record should have the all the accurate representations of the transactions, activities, facts. So all those things has to be done. Similarly, the integrity as well as the accessibility. So already I told you the integrity. So we need to ensure the data to be complete and untampered. Okay, so without any tamper, the data should be there. So accessibility all the time we should have the accessible by the authorized person. Okay, so that is very important. So when you make the electronic records. So, what are the challenges we are facing? So, the challenges is for the maintaining the electronic records. So, usually we'll be facing the greater risk for the potential security breaches and all those things. So, sometimes the virus attacks and all those things. So, that can cause you the damage of files and all those things. So, that is very, very important. Sometimes and due to the storage medium and all those things, we will be having the instability in the storing of the information. So that time, so we'll be losing some record loss. So if the patient record is we are losing, then how we will be enabling the diagnosis as well as treatment for that level. Okay, that is very very important. This is a challenges we are facing in the electronic record. So when you talk about the all the health organizations, so they will be maintaining the medical records for the several key purpose. So we need to all the organizations will be looking for the patient care. So all the informations whatever they provided from the patient end, so that has to be proper documented based on the documentations. So they will be planning for the patient care as well as the treatment. So when you look for the patient records, that can be used for the communication purpose. So whenever the physician, nurse, other consultations, if they are going, so they need to share the patient records and others. For that, so that's the patient records are very very important. So they will be collecting. Similarly, they will be looking for the legal documentations also. So whenever it's needed, so the patient records become a legal records. So that's whenever it's needed. So for when they want to describe, so that the whatever the treatment protocols and those things, they can use it for the legal documentation. Another important area of the medical records, the billing and reimbursement. So all the informations will be documented, and it will be useful for the billing services. So when they're going for the order is raised for to take the X-ray, so they will be having all the information. So that is also billing as well as the reimbursement. So the billing services will be useful here. So for that also they will be using the medical records. So whether the order is done or not, so whether the customer the patient is paid for the order or not, so all those things will come in the billing services. So similarly we have the research and the quality management. So that is also very important thing when you talk about the medical records, whatever the records they're storing into that. So they will be using all the information for the research purpose. So they will be getting the consent. From the patients, so for the research purpose and all those things. So then they'll be using for the monitoring purpose also of the patients. So that is also it's very very important. So we can ensure that the quality of care can be given. So when you look for the information's data exchange is so when you're looking for the message interoperability, so we need to ensure that, so already I told you, the patient information, the patient records has to be exchanged. So when you're enabling the exchange of information, so with the healthcare information systems. So we need to have the kind of interfacing units. So that interfacing units, nothing but we can say as interface engines. So this engines will be used to share the information. So we will be having the hospitals. So with the hospitals, so we will be having the through the communication mediums, we will be interfacing engines. So the interfacing engines will be establishing the communications whenever they need the exchange of information will happens. Okay, so currently we will be using the HL7 standards. So already we saw in the previous slides and all those things, classes. So how the HL7 standards and all those things. So that can be used to get the information about the patients. So it can be taken as a sharing of the information for the patient information and all those things. So we have the HL7 versions 2 as well as version 3. So that can be used for the purpose. Okay. So when you're looking for the standards we need to adopt when you are looking for the message interoperability, when you are looking for the exchanging of the information. So the EHR content interoperability, so we will be using the several standards. So but when you look for the telemedicine aspects, so we'll be looking for the HL7 clinical data architectures. So we'll be using that. So we have like a structured form. So the informations will be in the structured form, so that can be shared between the clinicians. So for the purpose of exchange. So because so when you look for the clinicians, so if they are going for the kind of second opinion and other things, so all the clinical content will be exchanged with the purpose. Okay, so that can take it here. Then we have like a GEHR as well as Open EHR initiative. So we have like a two-level methodology to model the EHR structures, electronic health records. So in the first level, so we will be having all the generic reference models. So that is going to give all the specific healthcare domains which is developed and contains only the few classes, like how the what is the role, what is the act, entity, participations, and others. So this all information. In the second level, so we'll have all the healthcare and application specific concepts, like the informations about the blood pressures, lab results, etc. So this very important. So when you're making with the electronic health records. Okay, so this also will be used with the used with the architectures. So the structured model will be used, so that can be taken further using the particular model reference and all this. So that is very important. So when you're looking for this, so that's also contains some rules. So when you're implementing with that. So HL7 clinical documentation, document architecture CDA. So that is organized in the three levels. So we can have the three levels. So the level 1, level 2, and the level 3. So when you're looking for the level 1, so that's going to focus on the content of narrative documents. So high level context, such as the parties, about the parties, roles, date and time, places from where they're taken, on the structural organization of headings and all those things. So all the information will be given in the level 1. In the level 2, so we will be getting as a fine grained observations and the instructions. So here we'll be looking for the all the informations with the headings. So with that, so there will be defining that. So that's a level 2. When you're looking for the level 3, so we'll be having the specifies semantics each information, so with that, so you'll be getting as a very the unique codes. Okay, so when you're looking for the unique codes, that can be taken for the processing of the information in the machines and all. So that's the HL7, the different levels. So the CD, the clinical document library. So we have the different structure. If you remember the HL7 architectures, we saw how the data format, so we can remember. So we have like a IHE cross enterprises document sharing XDS. So this is one of the industry initiative called integrating the healthcare enterprises. So we'll be integrating them XDS profile, so with that for the purpose. So we have like all the when you are looking for the all the documents, so we'll be storing the all the healthcare documents into the kind of registry or repository, common repository and all those things. So whenever we require the informations, we'll be using these architectures. We'll be facilitate of the sharing the informations and all those things. So I'll give you the example in the last slide how that's taken. So this is also used to have all the information, so healthcare documents. So in the integrated way, we can say. So when you look for the IHE cross enterprises sharing medical summaries, so XTS MS. So this is the all the medical summaries can be shared between the care providers and all those things. So because when they are going for the when you're going for the consultations and all those things, so the medical summaries are very important. So we have the different types of medical summaries, episodic care, collaborative care, and permanent care and all those things. So based on the clinical conditions, we will be having the medical summary types. So here also the will be specifying the content to the HL7 CD as well as the care record summary CRS will be missing. So when you're the medical summaries are very important. So because the medical summaries will be shared with the clinical care providers. So when you have the IHE, the retrieve information for the display. So because you'll be having all the information that will be retrieved for the display purpose. So this RID provides a simple and rapid read-only access, because all the information whatever you want to give for them and uh, the retrieve purpose. So you need to give on the read only access, so to the patient centric clinical information. Okay, whenever the users are from the outside. Okay, so located outside the user applications and other things. So when you are giving the this kind of read only access, so nobody can alter the information. So this also can support the CDA level 1 as well as the PDF as well as the JPEG formats and other things. So to share the information and other things, to retrieve the informations. So when you're looking for the retrieving of the information, so that can be provided through the web services, so that can be taken into. So when you're looking for the web services, again we need to ensure that all the data is secure. So other issues in the EHR, the interoperability. So the EHR interoperability. So we have some technical issues, so that must be also addressed here. So mapping of the patient identifiers. That is very, very important. So when you looking for the patient identifiers, so when you have the patient identifiers, so we'll be getting as an with the patient ID. So the mapping of the patient identifiers. So if you look for that, that's what we will see in the next slide. So how this all the enterprises will be those who are working in the authentication process. So entire organization, how we are going to take care of things, and then as well as the guaranteeing that all the computers involved in the consistent time. So those who are looking for the information sharing. So how the authentication nodes as well as audit trials will be. So that's another important area we need to look. So when you look for this is what I was saying. So we have like the different hospitals in the hospital A, hospital B in the different city. Okay. So when the say example the patient is visited the hospital B 10 years ago. Okay. So the patient now experiencing that sudden kind of some 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 kind of the uncomfort to the patients now. So the patient is having the kind of pain in the chest. Okay, so the patient wants to go for the consultation. So when the patient wants to go for the consultation, the patient nearby state, say example, this is hospital B in the different state, hospital A in the different state. Okay, it's not in the same location. So the patient is now in the near to the hospital A. So when the patient is admitted to the hospital A, okay, the patient was taken the treatment in hospital B 10 years ago. Okay, imagine 2 years ago. So when the patient is admitted to the hospital, they will be providing the patient ID. So the patient ID, the new ID they provided. Okay, so they want to ensure that they want to get the patient data, the earlier patient data. But when they introduce the new patient ID, when they are searching for the common EHR repository as well as a registry, so they are not finding any information about the patient because it says as it's a new patient ID. So we need to ensure that. So before giving the patient ID, we need to ensure that whether the patient has any common the patient ID. So for the common EHR repository and all this. So when they are searching for them, this patient ID, so they are not getting any information. So but in the hospital B, so they given us some other patient ID. So we need to ensure that. So what is the common EHR ID? So the common PID. So when you have the common PID, they can fetch all the information from the common EHR repository, so that they can get the history of the patients. So what they had any issues in the previous episodes and all those things, they can get the information. So integrating of the informations into the common the repository will help you to get the patient information. So that is very, very important. So when you talk about this the sharing of the electronic health records, so that's very, very important. So you need to have the common PID. So when you have the common PID, the problem will be solved here. So here they will be making the several